How do processed foods impact colon health? Have you ever wondered how the foods we eat affect our colon health? Processed foods, particularly ultra-processed ones, can have a significant impact on our colon and overall health. Research shows that diets high in these foods are linked to an increased risk of colorectal cancer. In fact, studies indicate that men consuming the most ultra-processed foods have about a 29% higher risk of developing colorectal cancer compared to those who eat the least. This connection has been observed over long periods, often spanning nearly 3 decades. One of the main issues with ultra-processed foods is their effect on our gut microbiome. This microbiome is a community of beneficial bacteria in our digestive system. When we consume a lot of processed foods, it can disrupt the balance of these bacteria. This imbalance may lead to a decrease in protective bacteria, which are essential for preventing inflammation. Chronic inflammation in the colon can create an environment that encourages the development of colorectal cancer. Additionally, ultra-processed foods are often low in nutritional quality. They tend to be high in unhealthy ingredients like saturated fats, added sugars, and salt. These components can lead to metabolic issues and promote inflammation in the colon, further increasing the risk of cancer. Some processed foods may even contain potential carcinogens, substances that could contribute to the development of cancer, formed during industrial processing. Interestingly, there are sex differences in the risk associated with processed foods. While men show a clear increased risk with high consumption of ultra-processed foods, studies have not consistently found the same link for women. One theory suggests that estrogen may provide some protective benefits against colorectal cancer in women. Moreover, a higher intake of ultra-processed foods is not only related to cancer but also to the formation of colorectal polyps, which are precursors to cancer. This indicates that limiting processed food intake could be a valuable strategy for prevention. So what can we do? Limiting our consumption of processed and ultra-processed foods, like packaged snacks, processed meats, sugary drinks, and fast foods, while focusing on whole, minimally processed foods can support colon health. Foods rich in fiber, vitamins, and antioxidants are beneficial. Maintaining a balanced gut microbiome and reducing chronic inflammation are key to these health benefits. In summary, evidence supports the idea that a diet low in processed foods and high in fruits, vegetables, and whole grains can promote colon health and lower the risk of colorectal cancer. Always remember to consult with healthcare professionals for personalized advice regarding diet and health.